You're watching Morning at NTV.
Thank you so much, Stephen Bide, for that information. Of course, we'll be linking to you later on just to see, did that app really work, and can people buy into it, so to speak, with regards to that being the ultimate solution to helping people maneuver traffic within the city. So we're getting into our Kickstarter conversation this morning, and it's what I've been hinting to you about, my gentle men, my men. Yes? Men out there. This is a conversation that you cannot afford to miss out on. And after this, we'll post this on YouTube so that you men who have the privilege of watching me live right now can head on there and share the link to as many friends as possible. Or let me just say this, to all your WhatsApp contacts, Facebook contacts, let's just ensure that all the men get this information. So this morning, how about you just start with some diet, that information coming through from dietitians with regards to how you can go about, you know, safeguarding yourself. Now, some research by dietitians suggests that diet may help prevent prostate cancer. But what are these foods, and what are the foods that you need to avoid and pretty much take up on with regards to matters prostate health? Now, they say that a diet low in red meat and animal products and high in plant-based foods such as vegetables and fruits may help to slow down the progression of prostate cancer and reduce the tumor growth. Now, later on, of course, right now, later on at this particular segment, I'll introduce to you a surgeon and a specialist with regards to matters prostate health. He's from India, and he's right here to ensure that we have these particular solutions. So let's take a look at these foods that I'm talking about. Maybe you're a fan of them. Maybe you're the kind of man who says vegetables, they just don't appeal to me. I'm a meat kind of person. You might have to think twice about it. Now, dietitians say that what you're seeing on your screen could be the best option for men with regards to just managing prostate issues and also staying safe and healthy with regards to the same. So just get into some more research. You could consult with your nutritionist, dietitian if you want to. Let's ensure that we are safe and healthy this year. That let's not wait for that time when you have prostate issues and then you have to go through that particular phase of seeking treatment and fighting it. How about to just steer away and, you know, prevent ourselves from getting prostate issues, prostate cancer, and so much more. All right? Okay. So it's time for me to introduce to you the special guest I have with me this morning. Now, population-based studies have shown that African American men have among the highest incidence rates of prostate cancer in the world. The Uganda Cancer Institute statistics show that prostate cancer is now the most common cancer among men in Uganda, with age-standardized incidence rates of 39.6%, 100,000 per annum, and 4.5% annual increase. Prostate cancer is a silent killer disease, but can be cured when detected early enough. So this morning, I'm joined by that particular specialist I've been talking about, Dr. Mohan Keshavamurthy.
Perfect.
Thank you. At least I've nailed that one. I was so worried about the second name, Keshavamurthy.
Correct.
Thank you so much, Doctor, for making time.
Thanks for having me on the show.
You're welcome. Prostate health. I think we can just start with that. For that person who is just, you know, interacting with this name for the first time, what is the prostate gland?
The prostate gland is unique to the male. It produces secretions that sustain continuation of the seed, in other words, fertility. The prostate secretion is a component, essential component of the semen, and for semen to be capable of procreation, of continuing creation of babies, the prostate secretion is vital. Hence, in God's scheme of things, it is placed in a portion behind the pelvic bone where it is almost impregnable. It's very difficult to injure the prostate. So it's, in practical terms, is equivalent to the uterus in the female. Now, prostate health, you have to look at three parts. Part number one is if there's an infection of the prostate, which is very common in the younger aged male and the sexually active age group. Then the enlargement of the prostate, which has got stacks for long life. The longer you live, larger is your prostate, and it causes urinary obstruction. So when you have difficulty in the short call as you age, that means that the prostate is enlarged and is pressing upon the urethra, the pipe that carries the urine from the bladder to the outside.
Correct.
The last and the most important point which you made is cancer prostate. It is more common in the African male, maybe 20 times more common than any other race. The reason for that is the African male is blessed with higher testosterone. If you look at the 100-meter dash in the Olympic final, you will find 9 out of 10 of African origin. They may be of different countries. That's because of the muscle mass that the additional testosterone gives them. But the underside of it, the lee side of it, is that it makes the African male more amenable to cancer prostate.
So you're saying that as much as the African man is blessed with a lot of testosterone, we're talking about 0 to 900.
Correct.
That's the range.
Correct.
It actually does act against them.
In terms of cancer prostate, it gives them greater muscle mass, the typical receding hairline, makes them immune to most other problems other men have in other races across the planet, but it makes them susceptible in an exceptionally statistically significant way for possible cancer prostate. And that's the reason that, and there is no specific test to diagnose cancer prostate unless you subject yourself to what we call as serum PSA, a blood test. And it's a very simple test available across Uganda, even in Wulu or Barara. You will have the facility to get a PSA done. Age greater than 45, once a year. I always tell men who meet me, on your birthday, make a gift for yourself, get a PSA done.
Yes.
It should be less than value of 4. If it is less than 4, it is age appropriate.
Okay.
If it is more than 4, see a urologist so that you would know what other investigations need to be done to quantify this 4.
Okay.
Not all more than 4 are cancer prostate,
Right.
but some are. And those who are more than 4 and get biopsied and you pick them up early, the point you made,
Right.
are the ones who will benefit by cure.
We'll be getting into that, and for you to just tell us what the process of, getting that PSA test done, because I think that is where a majority of men will say, that process, I'd rather just
Absolutely.
keep off. All right. So we talked about prostate health, and issues that, attack that is infections, enlargement, and prostate cancer.
Absolutely right.
All right. So let's start with the infections. Let's just go into the detail. How does a man's prostate gland get infected? What are some of these, factors that would lead to the same?
Absolutely. Now, it's a very interesting part. As I said, prostate is unique to the male, and it sits like a traffic roundabout. Urine comes from above, from the kidneys into the urethra. The sperm-containing semen portion comes from the testicles to the urethra, and all of it mixes and goes out through a common passage.
Correct.
So any infection of the kidney, any infection of the urinary bladder, any infection of the testicle will eventually cause an infection in the prostate. In God's scheme of things, as I mentioned, it is kept in a place which is impenetrable. In fact, there's a prostate blood barrier. So if nothing can go out, nothing can come in, is the principle on which God has created the prostate. But if an infection settles into the prostate, neither the antibiotic can get in sufficient force.
Wow.
It's like having a terrorist cell inside your house and you can't open the door. It's like a silo. So treating prostate infection is a low-dose antibiotic therapy over a prolonged period of time, and 1 in 3 will recover. Now, how does it happen? As I said, any infection in the urinary or the genital system will lead to prostatitis. Also, a conjugal partner can transfer it. It's a yo-yo effect. So hygiene, personal hygiene while having contact with your loved one, would not emphasize much more that if there is a possibility of the spouse or the partner having infection, protection using a condom becomes imperative. Also, drinking plenty of water, and when a urinary tract infection doesn't settle down with obvious oral medication given by a general practitioner, it is better to look at the possibility of prostatitis. And as I said, the frustration in not getting relief with the first course of antibiotics, if you are diagnosed with prostatitis, staying well hydrated, drinking 3.5 liters of water, taking oral
3.5 liters of water every day.
Every day in an atmosphere like Uganda, very similar to where I come back, with an ambient temperature of 37, 38 degrees. It would be ideal to drink 3.5 liters of water. Personal hygiene and protection when there's an ongoing infection between one of the partners to prevent the other partner from getting it.
So if, okay, let me just get as, basic as possible. What then happens, especially when you're talking about sexual health and hygiene? What happens to same-sex men?
Absolutely. The highest incidence of prostatitis will be in same-sex men. Obviously, as you rightly asked the question, and you made it bare bones, the elements that dominate a retropositive status are the elements that will dominate prostatitis, because both come from the same school of thought. If you do it safe, the word safe in capitals, wherein you do what you want, you do what would please your partner, but then you do it in a way that is safe for both of you.
What is safe, doctor?
Protection, lubrication, and most important of all, reporting an infection early. In the United States and most of Western Europe, contact tracing is essential for the patient to be treated for prostatitis in same-sex relationships. What we mean is, if a gentleman comes in with the infection in the area which we are discussing, then we would want to find out from him whom else has he been with in the last 6 weeks to 3 months, and then they get a free checkup to find out who is the progenitor and who is the receiver.
Correct.
If you treat only one half of a relationship, then the other half will return it, what we call as the yo-yo effect.
Correct.
And then it keeps on going like a table tennis ball across the net repeatedly.
All right. And you also say that even in, opposite sex kind of engagement, if the female is the one who is infected, then the man can also easily catch that infection.
Absolutely.
So I know, I can talk as a lady, a majority complain of UTIs,
Correct.
urinary tract infections.
Correct.
So are you saying that if a woman presents with such an infection, then there's need to, be careful, and that a man can actually get such an infection via intercourse?
If a lady in a relationship comes with a recurrent urinary tract infection which was not resolved in the first course of antibiotics or conservative measures, her doctor has advised her it's essential to do a urine routine and a urine culture of a spouse partner. Because only then, when you get the two of them healthy, anything below the belt is a partnership. And you will have to see that whatever gives you pleasure is done again in capital safe. So there should be no trepidation when a young woman comes across with a recurrent UTI. Her partner should also be subjected to a simple urine routine and urine culture. Because you get her healthy and you send her back and she goes back into relationship, then the possibility of the gentleman returning it or receiving it is as much as it was as prior to treatment. So it's critical that both partners are treated the same way, irrespective of which partner presented to the doctor with a urinary tract infection. In the case of the male, although it's less common, 90% of all infections happen in the female.
Right.
But it is easy to treat. 10% happens in the male. We call it prostatitis, very difficult to treat. So it's essential, as you rightly pointed out, that there should not be a sense of shame. And subjecting a loved one, to help a loved one, to oneself, subjecting oneself to a urine routine and a urine culture, I would say it's a token of love for a healthy relationship.
Correct. My ladies, I think now you have it. When you get a UTI, just go the two of you
Absolutely.
to the doctor. Don't just go alone and get treated and you think that, hey, we're okay, we're fine.
Absolutely.
Okay. So how does a man detect whether or not they have an infection?
See, generally drinking plenty of water with natural defenses, especially in the African communities, infection tends to go away. I would always say that the African population is the most blessed in terms of natural health, despite a rigorous climate whichever part of the continent you are in.
Correct.
Now, having said that, the most important part that happens is burning in urine.
When passing urine?
When passing urine.
Okay.
When you have deep-seated back pain, which doesn't seem to go away. When you have pain between your legs, but it is not coming from your testicles, what we call as perineal pain. This triad of back pain, perineal pain, and burning while passing urine constitutes prima facie the possibility of prostatitis or complex urinary tract infection.
Is it just general back pain or lower back
pain?
It's
lower back pain. Lower back pain, perineal pain. That is pain underneath the testicles, and you're very sure it's not coming from the testicles, and it's not coming from the place where you pass the long cord. So in that small area, it's called perineum, and perineal pain.
Okay.
Lower back pain and burning during passing urine. These are very typical symptoms, and generally they go to a local physician. He treats it appropriately, doesn't settle down. That's about the time prostatitis has to be considered. Instituting low-dose oral antibiotics who should solve this issue for both the partners.
Okay. At least now we've covered, infections with regards to the prostate gland. Let's talk about prostate enlargement.
Yeah.
You said that it actually comes hand in hand with age.
Absolutely.
So do we say that it's unavoidable because we all are going to get old?
It is inevitable. As I said, it's got stacked for long life. More testosterone stimulates the prostate cell to multiply. Unlike the female, there is no menopause, no andropause for the male, which isn't defined. In the case of the woman, at some point in time between ages 40 and 60, the monthly periods stop, and we define it as menopause. In the male, till his last breath, he is viable, he is capable. The volume of seminal ejaculate may reduce, the desire in some may reduce, but he still stays capable till his last breath.
So he can actually impregnate at 100?
Yes, it's possible, biologically possible. The reason for that is the male can't carry, only the woman is blessed to carry. He is just a medium of transferring genetic material, and God in his wisdom has given two different roles. But because there is no defined andropause, the testosterone secretion continues at a significant level, unlike the estrogen level in the woman cutting off. It perpetually stimulates the prostate. So the prostate, each year God allows you to live longer, tends to grow. Now, if you imagine the prostate to be an apple, the urethra goes through the center of it. So at some point, as the apple grows, it can't go beyond the bony cage.
Correct.
This is the boundary of your house. So it starts compressing the occupants within. So the urethra gets compressed, and that's when a 45-plus gentleman starts noticing that his short call is no more a short call. It's many short calls, or it is a long call. And he feels that he is unable to empty all that he has collected. His sleep gets disturbed. A combination of this compromises his social activity, because he has to be in and around an acceptable place to void when he feels it. Stops drinking coffee and tea, because he knows a half an hour after drinking coffee or tea or even alcohol, he has to go to the bathroom. So these are the symptoms of enlarged prostate, and to complete the answer to the question he asked, is inevitable. If God lets you live long enough, enlargement of prostate is inevitable.
So you're saying all men
who
will live to see their later years
a prostate
will have that issue.
Yes. But only 1 in 10 will need surgery. Now, if for example, if between ages of 45 and 55, there are say 100 people who came for prostate problem, only about 10% will undergo a procedure. But the 90 in the next decade are in the age group again for a surgery. So if you escape this decade with conservative treatment, and you are a very diligent gentleman, you're listening to everything that is on the Mala show, and you follow everything, you escape this decade. But if God blesses you with a longer life, and the Ugandan lifespan is increasing, and you would expect that prostate age-appropriate enlargement would be a large component of the aging Ugandan population, as it is true in any developing country.
So if we have a man who, you know, has the enlargement of the prostate and is not, you know, does not qualify for surgery, how can they manage it? How is it managed?
It's managed using a combination of an alpha blocker, that is something that will reduce the pressure within the prostate. The best example I can give you is a half a liter milk packet has 600 ml of milk. So there's intrinsic tension in the prostate. Alpha blocker lowers this tension. Simultaneously, we can use a medication such as dutasteride that will block the testosterone stimulation of the prostate, but allows him to still stimulate his muscles to stay big, stimulate his mind to stay optimistic, the typical male attitude, yet slow down the enlargement of the prostate. A combination of an alpha blocker with a dutasteride, freely available in Uganda, constitutes a conservative treatment of enlarged prostate. We usually use it for a year. It gives benefit for a few more years without medication, and you intermittently take this combination of two medications, and that will allow you to be socially relevant as far as your short call is concerned, assuming at all points that your serum PSA is less than 4, and it is only an age appropriate one and not a cancerous one.
All right. You know, for women, we're always told that if you want your girls down there to be healthy, you need to also help them in terms of, you know, producing good bacteria and maintaining that you have the positive bacteria down there. What's it for the men? Is there anything that they can do in terms of diet and, you know, what is in the plate and what they can take just to ensure that, if possible, they keep that man down there healthy?
Absolutely.
Or they can prolong their healthy span, you know, or just be able to delay this eventuality, because you're saying that for all men at some point in time,
Absolutely,
they will get this issue, the enlargement of the prostate.
We go back to your first slide on presentation: eating healthy, drinking plenty of fluids, maintaining personal hygiene. These three are the vital triad, 3 factors that will help you not only to possibly prevent but alleviate a cancer prostate once diagnosed. Having said that, there is no sine qua non, that is, there is no specific infection of food that can help or be prevented. But overall, as I say, sexual health or genital health is a triad of good hydration, personal sexual hygiene, with due regard for your partner, and the last and the most important, if you notice anything out of the ordinary, please visit a local, not a urologist, a general practitioner, the family doctor, and have yourself tested. Most of the times a stitch in time will save 9, and there is no question that as the necessity to be shy is a huge problem below the belt, as much as the Indian male as the African male. They're brave otherwise, brilliant otherwise. When I have practiced for a long time in North America, the difference between India, North American, Ugandan, or West African, East African, and whenever I've come across, is that their unwillingness till a very late stage to seek help, even if the help, like in Kampala, is 5 minutes walk from your home. So somewhere in the mind they should accept, if you live long enough, all parts of the human body are equally important, not the one you see in the mirror. So that's the take-home message.
Correct.
What you see in the mirror, everybody sees. What you don't see in the mirror, only you see.
Yes.
And only you can help by seeking help at an appropriate time, not from a specialist, from the friendly doctor whom
just
you
a
have already.
GP will
Absolutely.
do it. All right. So we talked about the symptoms of, you know, how to know whether you have a prostate infection, the prostatitis. How about the enlargement? Is it just about you know, not feeling, you know, okay when passing urine, the pain during passing urine? Is it just that, or there are other symptoms as well?
The first and foremost symptom in a gentleman aged more than 45 years is he gets up more often at night than he would have seen before, or the spouse tells him, you got up far too many times. The second that usually happens is he doesn't feel he has emptied all of the urine that he has collected. These are the 2 early symptoms: nighttime frequency of urination, and the incomplete sense of evacuation of collected urine. These are the two early things. Then it follows that you're finding you need to force to push the urine out. Then you don't want to stand up and void, you want to sit down and void. Then whenever you go to a new location, wedding or an office business, you want to check where is the toilet. When you reach that state that you are not sure, what we call as urgency, that you will have adequate time to hold and reach a socially acceptable place, is a time you definitely need help. I would always suggest that when your nighttime frequency, without any burning, without any pain, you just are getting up more often, or subconsciously you want to avoid that evening cup of tea because you have to drive from Kampala to, say, home, which is an hour away. You know you don't want to stop on the way, and considering the traffic, you do not want to stop on the way. That's the time you should ask for help.
Okay. Now we know. Now we know. Do the first two, infections and enlargement, do they affect bedroom matters?
Absolutely.
They do?
Absolutely.
Okay.
Because what happens is the focus moves away from what he was doing to his focus on what he should do to not get up often. As we all know, is not just the possibility of living together, but it's also the possibility of enjoying together. The enjoyment gets taken out because you only bother of spending the night with as infrequent disturbance as possible.
Correct.
And when the mind is not at peace, the body won't react. So it does come in the way, especially in the younger couples, the 45 to 55. There's a significant disturbance in their emotional health, because the spouse also gets disturbed every time the gentleman gets up, and then he wouldn't be willing to perform, because post-performance voiding urine will be a problem of great pain and difficulty. The best analogy I can give you is, if you leave a bucket under a tap and you forget to close the tap, the bucket is already full.
Yes.
Any new water comes in, there is no space. So you either leak or you run to the bathroom.
Correct.
You would want to avoid the situation. And that is what happens in nighttime frequency.
Wow. Wow. All right. Now let's get to the third issue that I think a majority know of. Many don't know about the first two, infections and enlargement, but a majority at least now know of prostate cancer.
Yes.
What is that? Is it a tumor? What is it?
We don't have a specific reason why prostate cancer happens so often in the male, but what we do know, it is a male hormone testosterone dependent tumor. For some reason, God forsaken reason, a cell in the prostate decides to become mischievous, multiply at a rate much more than it was supposed to. As I said, in the male, the cell has to renew itself till the last breath, unlike the woman. But for the same amount of testosterone stimulus, it produces many more siblings than it was supposed to. And that constitutes what we call as prostate adenocarcinoma. It's a male hormone testosterone sensitive tumor. Once it starts multiplying, it can have two different ways. Two different cancers can start in the prostate at the same time and grow at variable rate, what we call as multifocal cancer, or it could be only one focus, unifocal. So when we talk of prostate cancer, in the African and Afro-American male, African origin American male, we should look at what age did he first get diagnosed with it. Does he have an uncle, an elder brother, or a father or a grandfather who also had cancer prostate? And third, and the most important, which we will come to later in your discussion, if we do a biopsy, the biopsy is not just cancer yes, cancer no. If yes, what volume of the prostate was involved, what grade of the cancer was there, was it unifocal or multifocal? These would then determine, for the same treatment, different benefits. So people come and say, he had a cancer prostate, he didn't do well. The other gentleman had cancer prostate, he did very well. And both underwent the same treatment with the same doctor at the same hospital. If we get this subset information in place, then to a large extent a good clinician should be able to advise. The three questions anybody with cancer prostate will ask. The first question is, why me? And the answer, we don't know. The next question is what can be done appropriate to the stage we can treat, and the last part is what will be the quality and quantity of life if I accept the treatment which you are suggesting to me. So these three questions will be better answered with more information coming in, especially in a loud one from Uganda WhatsApp me. This is my close friend's father, and this is what it is. He has cancer prostate. He has cancer prostate, should be followed by, as I said, the biopsy report which shows greater detail.
All right. I think what has caught my eye and I think caught my attention is the first question that a majority of patients do ask you, why me?
Absolutely.
Are we saying that cancer is something that, you know, just happens to random people, you don't choose to have it, but can we say that, because the conversation about cancer has been prevention with prevention.
Absolutely.
Lifestyle, eating healthy, can those prevent someone from getting prostate cancer?
Absolutely.
Or is it just a gamble and you say that maybe one day, maybe not?
It's a wonderful point that you have raised. Prevention should be the mother of all healthcare initiatives for cancer prostate. Not only in Africa, anywhere in the world, but much more so because the resources in Africa are limited. Now, the prevention is age greater than 45, you need to do yearly PSA.
Okay.
It's a very simple blood test. It is prostate specific antigen. It is available across Uganda, as I told you, whether it's Gulu or Barara or Kampala, is available. And if you have a family history of an elder brother or a father or an uncle or a grandfather, then it is mandatory. But if it is not, it is optional, but I would always suggest, please, as I said, a gift of love for yourself on your birthday is do a PSA. It's less than 4, no worries. You are in the range. And that is the most powerful way to prevent.
Okay.
If it is more than 10, yes, there is a huge possibility you might have a problem. But you should remember both infection and cancer do increase PSA with the same frequency, half and half. So it could well be infection.
Tell us about this PSA process, PSA test process. Because when I talk to a majority of men, they say that test? So tell us about it. What does it entail?
PSA basically measures the amount of a biochemical substance in the prostate. It's a normally occurring substance, but we know when a mischievous cells multiplies rapidly, it produces more PSA. So we know that if PSA rapidly increases in a short period of time, it can't be age appropriate, it has to be age inappropriate, in other words, cancer prostate. It can happen because of infection too. Now in the case of infection, we do not expect PSA to go beyond 10. And we have something called total PSA and free PSA. Now free PSA, if it is on the lower side, it indicates greater possibility of cancer prostate than if it is on the higher side. Even the free and the total and the ratio, what we call PSA velocity, PSA density, are all calculations that can be done in any good health center in Uganda. So PSA is a simple blood test. It's an outpatient blood test. It's cheap, safe, available.
So it's just a simple blood test.
It's a simple blood test, nothing more than that. What people are more worried about, the biopsy.
Okay.
That is if the PSA is more than 4, we treat it with the course of antibiotics, it's not showing a downward trend, we are pretty sure it is not infection, we suspect cancer prostate, we then use an ultrasound probe or a finger guidance to take small bits of prostate tissue through the rectum. That is transrectal biopsy of the prostate. That is the process men dread because of 2 reasons. You are going from the neighbor's house, that's a rectum, to get into the prostate.
Yes.
So when you do that, the possibility of infection in the prostate subsequent to the biopsy is about 2%, 2 people out of 100. The possibility of a little blood in the urine is about 10%. Because of this discomfort, and as you know, those who have pain and discomfort, they'll magnify it in the park or in the workplace much more than the one who didn't suffer.
You don't use anesthesia?
Local anesthesia is used in certain patients who have other problems. General anesthesia is used, but the very fact that you're being poked in a private part, it may not even be necessary because 1/3 of the patients will not have cancer prostate who undergo biopsy, only 2/3 will have. But in all of medicine, we subject 10 people to such procedures to pick up 5 who will benefit from an early diagnosis and cure.
Okay.
So for your brother, you're undergoing a little bit of suffering, but we don't know in this roulette wheel who has got it and who doesn't. So in summary, anybody age greater than 45 with a PSA more than 4 on 2 consecutive occasions, which is not going down despite a course of antibiotics of a week to 10 days to 2 weeks, will need a transrectal prostate biopsy. It can be ultrasound guided, it's ideal, or it can be finger guided, which is what is commonly done.
All right. With the risk, especially like you're saying, with that particular process of getting an infection, medics working on alternative options to conduct such a test just to get that particular biopsy?
Some places in Uganda, including in Mulago, a transrectal biopsy with a very fine needle, 24 gauge needle, is possible. That is truly an outpatient, no nonsense procedure. It requires expensive equipment, and it also requires exceptional skill. But like retropositive has been treated on a war footing, both by information, by investment, by intent, which has brought about a transformational change which should make the next generation of Africans and Ugandans better. The same thing applies to prostate. It is the next epidemic on the anvil. You should know, in India, when we got independence, cancer prostate was the 4th most common cancer in the male, whereas it's the commonest cancer in age greater than 45 in Africa, in America, Africa, and Europe. But as Indians have started living longer, by 2030 it will be the commonest cancer in India too.
In spite of Indian men having
living longer,
yes,
despite having lesser testosterone,
yes,
we will have a full Uganda worth of 50 million worth of cancer prostate by 2030.
Let's now get to treatment then. It's unfortunate that the future is worrying, and
Yes.
it's up to men to just take this responsibility
Absolutely.
in their own hands and just get this test done. Like you said, annual is recommended annually. And
One simple blood test
Yes.
annually.
I'll make sure that the men in my circle give themselves that particular birthday
Absolutely.
gift of going for a PSA test. Treatment of prostate cancer.
If diagnosed early, there are 3 choices. If it's graded as grade 0 to 10, if it is 0 to 3 on the biopsy, it is mild, 4 to 7 is intermediate, 8 to 10 is severe. Most Africans and African origin Americans will have severe cancer, or at the most moderate. You do rarely see mild cancer in the African origin men. If it is a moderate cancer, you have a choice between medication, which will block the testosterone reaching the prostate, what we call as maximum androgen blockade, and that is possible only with medication. There is no need to remove the testicles unless the patient prefers the testicles to be removed instead of taking periodic medication. That is choice 1. This is called as intention to control. Then the intention to cure has 2 possibilities. One is radical radiotherapy and radical surgery.
Okay.
Radical surgery can be minimal invasive, laparoscopic, or robotic. So in summary, medication, radiotherapy, and surgery if it is in the curable stage. If it has gone beyond the prostate, beyond Uganda to Rwanda to Congo,
Right.
then you will have to treat it only with medication. And if it shrinks back into the prostate at a later point in time, salvage radiotherapy or surgery can be done.
Okay.
If it doesn't shrink, patient stays on oral medication. A small proportion, more often in the African origin males, will develop what we call hormone-resistant prostate cancer 3 to 5 years after using only medications.
Right.
Since cancer is the most researched topic in the US, every year new drugs come and they become cheaper the year after. The generics come up.
Yes.
By the time they reach East Africa, they'll be much cheaper than they were when they started off in America. And hence, we have newer medications which can even treat HRPC, hormone-resistant prostate cancer. The message I want to send across is every stage, every kind of cancer can be treated today.
And can be cured.
Diagnosed early, can always be cured.
Okay.
Diagnosed late, or if it has spread beyond the prostate, 90% of the time control is possible.
All right. Wow. Thank you so much, Dr. Mohan, for coming through.
Huge pleasure.
Thank you so much.
Thank you, Mala. Huge pleasure to be here.
Thank you so much. Wow. African men. An African man is 23 more times you know, more susceptible than the other men, yes, with regards to prostate health issues, prostate cancer, infections, etc. So men, let's take charge and let's ensure that you go for this PSA test every year to ensure that you are on the safe side. Early detection is the conversation with regards to cancer and its treatment. Thank you so much, Doctor, for coming
pleasure.
here.
Thank you.
All right, that's it for this particular segment. Keep your views coming. #morning@NTV. Like I said, we'll share this on YouTube so you can tell a friend to tell a friend to tell a friend. Let's be messengers and let's ensure that all our men know this and have this information. Let's take a short commercial break. We'll be back.